We know that Milken Institute has redirected its efforts to combat COVID-19. Now, you're working with health institutions, governments in areas like treatment and cures. Give us a sense of how far or how close we are to finding this vaccine. Can it be sooner than the 12 to 18 month time frame that we're looking at right now?
Haslinda, as you mentioned, we have broken our efforts into 6 areas as we've redirected the 10 centers of the Milken Institute: education, testing, prevention, treatments, cures, and financial safety nets. The question you asked about vaccines, there's almost 70 vaccines we are now tracing. One went into human beings on March 16th. That was the Moderna vaccine. And there's a feeling if it was successful, they might be able to produce it in larger quantities beginning in September or October. However, the issue of cure is first going to occur with control. And the monitoring of antivirals or antibody or immunology efforts to control the virus first, to track those that have had it and those that haven't, will come before the vaccine. And yes, in the UK and other places around the world, there are those that believe they might be able to bring a vaccine by the end of this year.
What's been the biggest challenge in containing COVID-19, Mike? You talk about how that has to come first.
The biggest challenge is this virus moves very quickly, and no one's immune system had ever seen it before. So it has had a significant response, and a large percentage of the deaths are primarily due to this cytokine storm that occurs with the response. And so we have turned to cancer. Many of the new immunology drugs that were developed over the last few years have had to deal with this cytokine storm and have the potential to control it. So the first step to control is to find a way to use things that have already gone into human beings, been used for other purposes in the past, and can be directed. Once we bring it under control, then ultimately a vaccine will make people comfortable going forward. Bioscience is moving faster than it's ever before in history, and the cooperation throughout the world is unprecedented at this time. And the tracker that you spoke about, that tracker covers more than 100 different therapies, vaccines, antibodies, antivirals, and where they stand in moving into human beings and what the results of their work have been.
Mike, even if a vaccine is found, the issue really is about manufacturing and distribution at scale. We've already seen the likes of India banning the export of malaria drug, which could help in the treatment of COVID-19. I mean, economics, politics stand in the way of this vaccine being made available. How do you ensure access?
This is an issue we've been very focused on, our Center for Faster Cures, Public Health, and others. And I have been doing, I think as you know, Haslinda, these podcasts every day, 1 or 2 a day. They are on Apple, they're on Spotify, and Alex Gorski, the CEO of J&J, talked about in our podcast the technology that they're creating, if their vaccine works, to create millions of vaccines quickly. And as you probably know, they have agreed to provide them free to everyone in the world. So, yes, the challenge of ramping up, but the technology that Johnson & Johnson and others have focused on will allow us to create millions and millions of doses quickly.
And Mike, we heard from Neil Kashkari recently. He said that the U.S. is at risk of having 18 months of a rolling shutdown if we don't have this effective vaccine. Your thoughts on that?
I think the shutdown issue really is going to be dealt with by these antibodies, knowing who has had it, who can't get it again, and who can return. And my guess is Google, Apple, and other companies right now are focused on how maybe we can give you something on your phone to tell you that you have antibodies as we measure. At the beginning, we were focused just on testing to whether you had the virus or not. Now we're very focused also on testing to whether you have antibodies due to the fact that you had the virus. So not just that you had the virus, but what proteins have you created so it's safe for you. You will not give the virus to anyone else, and you cannot get the virus. We don't know at this time what % of the population has actually had this virus. In some areas, it might be 30 or 40% of the people. And if they had built up these antibodies that we have the tests for, there would be no problem of them returning back out in society. And those that are at risk or have any preconditions, we can keep them isolated. Everyone wants to reopen the environment, get the economies going again, but it's going to take this testing to do it, and ultimately a vaccine.
Mike, this pandemic is sending the global economy into tailspin. Ray Dalio says that there is a possibility that the U.S. economy could see a depression. Do you agree with that? And what do you make of the efforts so far made by the Fed? Has it done enough, or has it gone too far?
It definitely has not gone too far. I don't see us going into a depression. The most optimistic message I can give you is hundreds or thousands of bioscience companies are working on a solution here. Dozens or maybe even 100 companies are working on a testing solution. Science has advanced so much. Sometimes we do not forget something that you and I have discussed constantly, that every human life is priceless. And if you save one life, you save the world. On an economic standpoint, public health and medical research has been accountable for more than 50% of all economic growth in the last 2 centuries. The doubling of life expectancy in many parts of the world, and not only increasing life expectancy, but the quality of life. And I think whether it was the interviews with Alex Gorsky, the CEO of J&J, the world's largest health company, or Francis Collins, the head of the NIH, or David Baltimore, who won a Nobel Prize for his work on viruses, or Eric Schmidt, the former CEO of Google, talking about what we need to do to open the economy. I believe we will find a way to start to open the economy once we establish who has had the virus, who has antibodies, who hasn't had the virus, and ultimately a sense of normalcy will occur when we get vaccines. With 70 of them working today, I am very confident that we will find one or many of them that work. However, I believe you're looking at the first quarter of 21 for that to occur, why we have to first control and test.